receives the blood from the external jugular vein and then internal jugular vein. Okay, so this is internal jugular vein and this is external jugular vein. Okay, these are the vein, they drains blood from the head, neck, face, that area. This subclavian vein now as soon as it joins with the internal jugular vein, its name is brachiocephalic vein. Okay, its name is brachiocephalic vein. Brachiocephalic vein, BCV. Okay, and this brachiocephalic vein joins with the another brachiocephalic vein and its name is superior vena cava. Okay, the left brachiocephalic vein is longer than the right. This is left and this is right. Okay, left brachiocephalic is longer and then the right, and they both joining together forms the superior vena cava, and this superior vena cava ends into the right atrium of the heart. Okay, so now so far we understood that the superficial venous system is on dorsal side and the ventral side, both sides, and they are skin and under the skin level. They drains blood from the mainly from the dorsum of the hand and on the lateral side and the medial side or radial side or ulnar side of the hand, forearm and the arm. Okay, so on the medial side there is a basilic vein, on the lateral side there is a cephalic vein, and they are visible. Okay, and they runs towards the arm and it collects the superficial vein, venous blood. Okay, and it drains, it moves upwards, and at the same time it also gives the blood to the deeper venous system through the communicating or perforating veins. Okay, so they can take the blood directly towards the heart through the deep vein, and they also transmit their pressure into the deeper vein, because the superficial venous system has the higher pressure than the communicating vein, and communicating vein has the higher pressure than the deeper vein. Okay, so now basilic vein, finally it drains into the brachial vein, and it is in the upper part of the arm, and the cephalic vein drains blood into the axillary vein. Okay, axillary vein more proximal to the arm. And finally, the blood is, all bloods are carried by the axillary vein, and this axillary vein is formed by the outer border of the teres major muscle, and this axillary vein at the outer border of the first rib, its name change, name is subclavian vein. Okay, subclavian vein. And this subclavian vein receives blood from the external jugular vein and the internal jugular vein. After internal jugular vein, then its name is brachiocephalic vein on the right side. Then it joins with the left brachiocephalic vein and form the superior vena cava. Superior vena cava. Superior vena cava drains blood into the right atrium. Okay, so I will show you that there is a communication between the basilic vein and the cephalic vein in front of the elbow joint in the cubital fossa, and that vein is communicating vein between the two major superficial vein known as antecubital vein. Antecubital vein, and that antecubital vein forms in front of the elbow joint, and they communicate each other, and the other superficial veins between the basilic and cephalic, there are a vein develops called median vein. That median vein also collects blood from the cephalic vein and the basilic vein, and this median vein joins into the brachial vein. Okay, brachial vein. Okay, so in that way the whole venous system in the upper extremity is conducted easily. Okay, so now I will show you the valve system. The valve system in the venous, the valves, those are present in the vein, and the lower extremity has more valves than the upper extremity. Okay, so valves function is very important. Okay, let me check the camera is okay because the board has moved. Okay, it's fine. Okay, I'm just showing by drawings Okay, I'm just showing from the two palmar venous arch. So this is superficial venous arch, and this is deep venous arch. From the superficial, I'm just going directly to the okay. Okay, the ulnar vein, and this is deeper, the deeper is from the radial vein. Okay, so deeper venous arch forms the radial vein, and the superficial venous arch forms the ulnar vein. And as I mentioned that these veins are paired vein. I'm drawing it twice so that if you have a little confusion, you can remove it. Okay, and now I will show you the median vein is formed. This is the median vein, and the median vein also joins with the brachial vein. Okay, so this is brachial vein. So now brachial vein, ulnar vein, radial vein. So these are part of the deep vein, but this is median vein, is a superficial vein. Okay, sorry, superficial vein. This brachial vein, on its way This is brachial vein. On its way, it receives the basilic vein. Okay, and at the outer border of the muscle, let me draw that muscle. Teres major muscle, and then its name is axillary vein. Axillary vein. And this axillary vein receives blood from the cephalic vein. So this is cephalic vein. Okay, so now this is axillary vein. This is axillary vein. This axillary vein at the outer border of the first rib is name changed. So this is its name is subclavian vein. Subclavian vein receives blood from the external jugular and internal jugular. Then its name is brachiocephalic vein. So this is external jugular vein, this is internal jugular vein, and this is right brachiocephalic vein. Okay, so now this right and left brachiocephalic vein joins together form the superior vena cava. Superior vena cava. Okay, so now if I show you the superficial vein, so this is superficial vein and this is perforating vein. Okay, so this is superficial vein, these are perforating vein, and the perforating vein joins with the deeper vein. Okay, so the flow of the blood is from the superficial to the perforating, from the perforating to the deeper, because the higher venous pressure is in the superficial vein. Then blood will move these directions. then blood will move this direction, some of the blood, and will go to the deeper vein, and the deeper vein is flow is towards the proximal part of the body. And this is controlled by the venous valve. Superficial vein and the perforating veins, they have valves. Superficial vein has more valves than perforating veins, and the deeper vein has less valve than the superficial veins. Okay, so now the importance of knowing this upper extremity venous system is there might be venous congestion, there might be venous pressure increased, that leading to edema formation, and that can happen anytime when there is a mechanical obstruction of the vein, when there is a DVT formation, deep venous thrombosis in the deeper vein, and when there is absence of venous valve, congenitally absence. That is another cause of venous backup or congestion. There is another cause called secondary venous valve diseases. We call it venous valve incompetency due to some defect in the valve. In that time, there is too much venous blood backup. The venous disease in the upper extremity is less than the lower extremity. And the venous disease in the upper extremity is less also. The reason is we move our upper extremity more frequently than the lower extremity. So that venous return is more in the upper extremity than the lower extremity. That's why there is a less chance of venous blood in the upper extremity stagnation than the lower extremity. And if we prolong time standing, so lower extremity venous return facing lot of gravity challenges, but upper extremity is close to the heart, and we move our hand on and off, so venous return is more. So the chance of DVT formation is less in the upper extremity, but still it is possible. Another condition I'm going to show you, that sometimes we had a radical cleaning of the lymphatic system in the upper extremity due to the breast cancer. In that way, the patient will suffer from upper extremity heaviness, swelling, edema, and not feeling good, and even though there might be DVT formation. Okay, that is a big challenge. Why? Because lymphatic drainage returns the body tissue fluid or interstitial fluid, or we call it lymphatic fluid, into the venous system, and depending on the location of the venous obstruction, some lymphatic obstruction, lymphatic backup may develop distal to the obstruction. So venous diseases also impacts the return of the lymphatic system. Lymphatic system also interfere with the fluid exchange between or among the intracellular fluid level, extracellular fluid level, and intravascular in the capillary level. There is a fluid exchange at the cellular membrane level. There is a fluid exchange, and that fluid exchange also goes with the electrolytes exchange and also gaseous exchange and the waste product. So when there is an obstruction of the vein, obstruction of the lymphatics, so actually the tissues are the sufferers. Tissues are the sufferers. So we don't want that. And keep that in mind. When there is a venous return insufficient, when there is a venous pressure is increased, then arterial supply is diminished. Why? Because the artery faces the lot of resistance ahead, because their blood, arterial blood is supposed to be drained by the vein, but the vein is not running good because of the backup. So at one point there will be compromise of the arterial supply. As a result, the nutrition will be insufficient, oxygen will be insufficient, actually the tissue starts dying. And that tissue death, prolonged time. Venous congestion, venous pressure is high, tissue death started, you will see the change of coloring of the skin level. Then at one point you will see that there is a venous ulceration developed, and that is the worst sign. So if you want to save the parts, you need to look for the location or the site of venous obstruction. You have to remove the venous obstruction, occlusion, whatever you say. So now, is there any possibilities that collateral circulations may develop? Of course. The superficial, perforating, and the deep, all those veins develop. Already there is existing collateral circulations, and when there is a backup, so lot of veins will be open because of the pressure is increased, and there is high percentage or high chance of collateral circulations development, and all the venous blood may return. Okay? And there might be temporarily congestion, but it can go away. That's why they do the physiotherapy, the exercise, so that vascular supply and return may enhanced. As a result, the chance of complications will be less. Okay? So now, just showing you that this is cephalic vein, and the cephalic vein is here. Okay, and this is basilic vein.